other schools that put together a program like this or carry it off the way that NYU does. And if you can get involved in something like this, it's life-changing and it's completely worth the time and effort.
I think there's more to dentistry than just working in an office. And the fact that you can give back to people, you can be in an environment with individuals who don't really practice good oral hygiene or really know what's out there, the options out there for them. If I can contribute to that in some way, I think that's amazing.
The town Copán is a town in the mountains. It's about 3 hours from the airport, and it has about 6,000 people. Most of them are farmers. Surrounding the town are a number of communities called aldeas, and there's actually 20,000 Mayan descendants in these aldeas. In Copán, they have a city center. We go in and we set up areas. We bring 1,500 pounds of equipment and supplies. We get tables, we get sit-up chairs. It actually only takes 2 hours to convert this from this empty shell into a functioning dental clinic. But when you have 35 people setting things up, it does occur rather quickly. We bring several groups. We bring a pediatric group. We bring a group, an endodontic group to do root canals. We bring a surgery specialist with us. And this year we also brought a nursing group because we are looking to incorporate systemic health with oral health, and they are very, very related. And this area in Copán has a lack of health care in general.
I did think I was going to come back and be exhausted every day and, just by the third day, just not be able to go on. But we were all energized. It was a great group of people. We were all there for a common goal, and you're just running on adrenaline. You're loving what you do.
There are trained professionals there that we can work with. And what is our role? How do we provide a synergistic service to fit and complement what's already existing, and not to duplicate, but to actually add some value, to work on prevention, to talk to patients and their families and teachers and healthcare workers about diet and how that might affect oral health. So to sort of add a more of a public health perspective. And what I mean by public health perspective is really health promotion, disease prevention.
Cultural competency is something that's becoming increasingly important, especially within healthcare professions. And so it's a very intense experience for students to go and be in a very different environment and talk to people who have very different backgrounds from their own. So we think it's very important to go out to villages with people from the community who can help us identify community leaders, who can help build that relationship.
Whether it's a teacher or a health representative or a nurse, who now can actually be our advisors, can actually set the agenda for what our program is going to look like in the future. And that's what's really exciting about this partnership as we move forward.
It's changed my perspective a lot, because what you learn is that it's not always about doing one thing for one person. It's about doing as much for as many people as you can in that sort of a situation. So it just makes you think more globally and less about the one task that you have at hand.
With the adults, most of the care is emergency care. There's very, very little health care in general there. There is almost no oral health care there, certainly for the poor. And we're probably the only dentists they see. What you tend to find with a lot of these individuals is that they live with pain and infection. It's just part of everyday life, but certainly not necessarily a healthy way in terms of oral health care. Some people walk 5 hours from aldeas to see you and get care. But it's a developing country, and it's not so unusual. In New York, there's one dentist to 1,400 people. In developing countries, there are as many as one dentist to 150,000 people.
Skill-wise, I'm a lot faster than I was before, and I'm a lot less timid in getting in there and actually doing the work. Otherwise, it's made me more confident, it's made me more able to trust my skill set, and it's made me aware of what else is out there and what else I can do, what else I can keep doing to keep helping people after dental school's over.
I've walked out of there with a lot of confidence that I think probably would have taken me beyond the 4 years of dental school to achieve. And I think that that goes beyond restorative dentistry. It goes into teaching oral health care.
I want to go back because I had the best time. This was by far the most important thing that I've done in dental school. It made the biggest difference, I think, out of anything that I've done so far, because you get to really help a lot of people and you get to meet a lot of great people on the trip, and you get to really get close personal attention from faculty. So you get a lot of training on top of providing all this care for people who need it.
I guess it was the link that incorporated my dental school experience with who I was as an individual, and that is probably, now that I think about it, the most invaluable thing I got out of this trip. So, here I am, happy.
That was one of the main reasons that I interviewed at NYU, is I knew that they had the programs here and I thought that they were just outstanding. It taught me how to reframe my mindset as to why I was doing this in the first place, why I wanted to go to dental school, why I wanted to be a dentist. And that primarily is to help people.